Let's talk about some of these different conditions. You mentioned ME, which is myalgic encephalomyelitis. That's an unfamiliar term for most Americans. I know that's kind of the more common to hear. I think maybe just in the UK or maybe in other places in Europe. But there's a number of related conditions here. CFS, ME, kind of synonymous, and then fibromyalgia, and then multiple chemical sensitivity. And I would love if you could just talk about some of those. There's also, we could also talk about some of these other things like adrenal fatigue and HPA axis dysfunction and burnout syndrome. And there's all these other names, but I think CFS, fibro, multiple chemical sensitivity, it'd be great to kind of clear things up there.
Yes. A lot of these conditions have what we call an arbitrary diagnosis, in the sense of, here's a list of symptoms. Do you have 5 of these or 3 of these or 2 of these? And what we're doing is we're fitting patients into a box, saying, right, according to this tick list, you fit into this box. According to this tick list, you fit into this box. And actually, all of these conditions are related and have the same underlying cause, in my humble view. And it's a spectrum of different conditions with an emphasis on a particular area. So ME and chronic fatigue syndrome, the emphasis is on fatigue and some immune symptoms. Yeah, that tends to be what differentiates it. Fibromyalgia, there's more of an emphasis on pain. Chemical sensitivities, that is a bit more different. That's more an emphasis on, obviously, sensitivities to chemicals and mold and things like that. Then we have electrical sensitivities, where people become highly sensitive to electrical fields and mobile phone radiation. Then there's even irritable bowel syndrome, which is very common in the population, where people have symptoms predominantly in the stomach. And I believe that all of these different conditions, they're very similar and have so many crossovers because there's a similar underlying cause. So many people with ME and chronic fatigue syndrome will have pain. Many people with fibromyalgia will have chemical sensitivities because the underlying neurology is very similar. And so I term all of these conditions neuroimmune conditioned syndromes, or NICS, NICS, because the neurology is essentially involved. We know that. Well, not that we know that as a root cause, but that's my view. Immune, because in most of these conditions, aspects of the immune system are involved. Conditioned, because I believe the system has got into the habit of responding based on a previous experience. And a syndrome, because there's not one specific set of symptoms you can say that every patient has. There's a whole bunch of symptoms together. And I think that when we start talking about neuroimmune condition syndromes, it helps people feel that there's not a justification, but there's an understanding of what's actually causing the condition, rather than thinking it's psychosomatic, in any way.
Yeah.
I would have that title for all of those conditions.
Excellent. So, one of the things you and I chatted a bit over the phone when we spoke the other day was, which I really resonated with and I really enjoyed, was this idea of all these different schools of thought, and everyone kind of myopically zeroing in on one particular thing that they think is the thing. So it's the inflammation, or it's the oxidative stress, or it's, we found sleep problems in people with CFS. It's the sleep. It's a gut issue. It's it's a HPA axis issue. It's this, it's that, right? So there's all these different kind of camps, all these different schools. Now, what led you to the conclusion that the primary source of the dysfunction is in the brain?
Well, just like yourself, I've had a similar experience where I present at the MECFS conference, which is held every couple of years. And in the room, you have every single representation of medicine that's present. And each of them has found an abnormality. And each one says, aha, we found the root cause because we found this physical abnormality. And they'll go up and they'll present, and everyone will be, wow, yes, maybe that's the cause. Then someone else will come and present and say, well, we found this, and we found this, and we found this. And you suddenly realize that it can't be that they can't all be right in terms of a root cause, but they can all be right in terms of those observations. Mm-hmm. And what is it that affects the entire system is the nervous system. So the nervous system in some ways is like the software of the body. It runs the hardware. Yeah, and the central nervous system is that software, and the brain is the head of that software. Yeah, which makes sense. And so I do believe that whilst there are local effects, the programming, the software is what's going wrong, and the software predominantly sits in the brain. And that then makes sense to me that when the brain is malfunctioning and not keeping the body in homeostasis or balance, when it goes out of balance, that will affect every single cell, organ, and system in the body. And therefore there can be a very obvious centralized way that this could be occurring.
Mm-hmm. Yeah, I want to give people a little visual to understand what we're talking about, because people who are not already science geeks may have a bit of difficulty kind of grasping this concept, how there could be multiple layers of dysfunction occurring simultaneously, and why it's so important not to zero in on the wrong one, or one that is not a central cause. Imagine, just as a quick, simple visual, imagine like a stream, and at the top of the stream, somebody's pouring all kinds of pollutants and radioactive stuff and into the stream. But downstream, people are eating fish out of the river, or eating plants out of the river, and getting sick from it. And so we think, oh, it's the plant that's the problem, or oh, it's this fish has a certain toxin in it, and therefore the fish is the problem, right? So we need to, for everyone listening, I'm just trying to illustrate upstream versus downstream effects. So there's some kind of more upstream thing that's going on, and then there might be other layers of dysfunction that occur later on as a result of that underlying root cause. So what Ashok is saying is basically that what he believes is, based on this evidence, is that the brain is really the central player, and then there are many other layers of dysfunction that occur in the body as a result of that dysfunction. Is that pretty accurate?
Yes, and not only that, there can be secondary conditions which occur. So let's say eating those fish downstream may then cause another secondary effect, a kind of condition of its own, which then complicates the situation. So then, as an example, if we've got a compromised immune system upstream, so that's your equivalent of pouring the poisons down the stream. If we've got a compromised immune system upstream, downstream, that means that we're then going to have high viral titers. So we're going to have higher loads of opportunistic viruses and bacteria in the body. And those opportunistic viruses and infections will cause further downstream effects. And that's when then researchers say, aha, we found X% of patients have too many of these viruses and bacteria. Therefore, that's the cause and that's the reason for the condition.
Right. And if I could just add one thing, I think it's a shame personally that so many people are locked into that kind of reductionist, myopic view where they're looking for the one biochemical abnormality, and they're not looking at things holistically, like what you're talking about, like how this is a big picture, how vicious cycles can be created through some of these downstream dysfunctions now, create their own vicious cycle and lead to more dysfunction. Yes,
absolutely. And I think it was something that you mentioned about when you were studying medicine, that I think you mentioned an example of diabetes where they're talking about diabetes, but there's no mention of diet and activity as a way of improving it. And in the same way, I think that we're only going to solve these NICs, these neuroimmune condition syndromes, when we recognize that there's something wrong with the software and a more holistic vision is required, rather than honing in on one particular thing that's wrong, finding a drug that will then treat that one particular thing.
Yeah.
And if we find the miracle drug that cures all of these conditions, brilliant. I'm out of a job.
Yeah.
And I would love to get everyone better and I'm happy days. But I don't think that's ever going to happen because of the nature of their software conditions, not hardware conditions.
Right.
Software's gone wrong.
Yeah.
Which then makes it look as if the hardware is malfunctioning.
And on that note, I think so much of the line of thinking and research that goes on in the pharmaceutical industry, is basically that. It's looking for the one biochemical abnormality, in so-and-so disease, and then how can we find a drug to interrupt that biochemical pathway, and with the idea that that's going to lead to a cure. And outside of infections, acute life-threatening infections, I think that paradigm and that approach has been a pretty massive failure when it comes to chronic conditions.
Yeah.
And I think, kind of going back to that visual of the stream, it's not about interrupting how the toxin, gets into the plant or the toxin gets into the fish. It's about going to the top of the stream and stopping that person from pouring toxins into the river in the first place.
Exactly.
Yeah.
Exactly. Yeah.
So when it comes to CFS, what are the main causes? Like, what does this actually look like in terms of, I know on your website you have a nice visual of kind of underlying predisposing factors and then some of the main triggers for the condition. Can you kind of just take us through what this whole process, what this whole sequence of events looks like, and what it manifests in?
Yes, absolutely. So I'll use an analogy which I think will kind of help. So before I look at the analogy, I'll talk about those predisposing factors. So we know there could be some genetic factors that make it more risky for someone to get a neuroimmune condition syndrome like CFS, like fibromyalgia. And that's often combined with chronic or acute stress combined with some kind of illness. Yeah. So we've got three factors: some genetic factors, perhaps some factors around upbringing. Then we've got the physical trigger, so the illness, and then chronic or acute stress. And most people do recall a period of chronic or acute stress in the run-up to getting the condition. And I'd like to give the analogy of let's say your body is a castle, yeah, and you are the king of the castle. So the conscious mind is the king of the castle, and your body is the castle. And the army and the navy are like the immune system and the nervous system. So let's say the army are the nervous system and the navy are the immune system, and they're there to defend the castle. Yeah. Now, if that castle is under a lot of stress, let's say there's been a bad harvest, let's say, or they've already fought some wars recently, the whole castle is exhausted. Yeah. The army and the navy are exhausted. And that's equivalent to the chronic stress that people are experiencing at the beginning of the condition. It just creates all of the immune system and the nervous system are not functioning correctly. There's exhaustion in the system. Yeah. And one of the reasons that exhaustion is happening is because the army and navy have been fighting all these battles. Yeah. And because they're exhausted, the next virus or bacteria comes over the hill. So the next invading army comes over the hill, and the army and the navy, they're so exhausted, they're fighting and it's taking them ages to defend the castle. Whereas normally they would have fought off those invaders within a week. Now it's taking months, weeks and weeks, months and months to fight off these invaders. Eventually, the body and the army and the navy have fought off that invading army. But the whole castle is exhausted, thinking, we just can't handle any more of this. And the army and the navy become so traumatized by the experience they've gone through, because survival is the most important thing. And they're thinking, if we don't defend against another invading army, we're going to lose the castle. Everyone's going to die. So then, to err on the side of caution, when they simply notice anybody coming over the hill, they massively trigger the nervous system and the immune system. So the army and navy suddenly send battalions over the hill just at the even mere suggestion that they may be under threat. And then what happens is simply the fact that the whole castle is exhausted, those signals from the body become a trigger to the brain that we're still in survival mode. We're still in danger. Yep, we're still under threat. And so the brain detects the signals from the body, the signals from the castle, thinks, uh-oh, we're still in danger. Survival is paramount, and we're still in danger. Let's trigger the army and the navy. Let's trigger the immune system and the nervous system. So then the brain triggers those systems continually, which then creates the symptoms in the body. And those symptoms in the body circle back to the brain again, and the brain thinks, oh no, we're feeling exhausted. We've got even more symptoms. We will not be able to survive another attack. Quick, trigger more immune system, more nervous system. And then we get caught in the vicious cycle where the brain is over-triggering defensive systems, which is causing the very issue it's trying to defend against.
Mm.
The brain gets stuck in a loop, essentially. And what's interesting is every year, so we talk about flu, every year thousands of people, hundreds of thousands of people die of flu when they have weakened immune systems. And many people report that when they first got ME and chronic fatigue syndrome, it was after some kind of flu-like illness. And that shows us that the body can go into hyper defense mode as a result of a flu virus because it is life-threatening to us.
Mm-hmm.
And it becomes then that self-fulfilling prophecy in terms of the brain anticipates danger and is creating the very danger that it's sensitive to.
Mm.
So eventually the whole system becomes so exhausted that there's adaptation in receptors, the HPA axis is no longer responding. When we have to do an activity, the system is just downgraded completely because it's so used to the overstimulation. And we've used up those hormones and those neurotransmitters that normally make us feel good. So we've got low serotonin, dopamine, oxytocin, adrenaline, noradrenaline. The whole system is exhausted. And therefore we can no longer respond to stress and to activity.
Mm-hmm.
Yeah.
So it's interesting. There's so many different layers of dysfunction going on. So, there are studies, as we talked about the other day, there are studies about different biomarkers in chronic
Mm-hmm.
fatigue. And so, you might look at inflammatory cytokines as a potential biomarker. You might look at HPA axis dysfunction and morning cortisol or diurnal cortisol curves during the day and how that relates to chronic fatigue, or oxidative stress going on in the cell or the blood or something like that. And so all these people kind of looking at those pieces of the puzzle and maybe even identifying certain abnormalities in certain cases. Why do you think it's the brain specifically? Like that's the crux of it all?
Well, as mentioned, because every peripheral system is affected so powerfully, there must be a centralized mechanism that is causing this.
Okay.
On top of that, we know that in CFS and fibromyalgia, the CFS community are now catching up with the fibro research in terms of brain research. We already know that there are profound changes in the brain. So we know there's reduced volume in the prefrontal cortex of patients. We know that the insula shrinks. So the insula is the part of the brain that essentially takes in all incoming information from the body and creates an appropriate autonomic response and an appropriate immune response. But we know that that part shrinks and becomes hyperactive, as if it can't handle all the incoming data and is overstimulating the brain. We know that from some EEG research, we know that the brain goes into hibernation mode, where it literally, it's so obvious why people can't think clearly and can't recall and their memory is poor, is because the whole brain is almost shut down. It's almost in delta wave sleep mode because of the overstimulation and the exhaustion. So there's so many physical abnormalities and brain abnormalities. We also get inflammation in the body, inflammation in the brain. And I believe that this is in the brain simply because after that traumatic event, so the traumatic event is the physical illness and the chronic stress, a legacy is left from that interaction. And the brain, as the kind of superior part of our bodies that keeps us safe, ensures our survival, is also the head of the immune system, as more and more research is showing. Therefore, to me, it's the most likely candidate for this.
Mm-hmm. Yeah. Great. And I know you've talked about, you just mentioned kind of some of the inflammatory or immune abnormalities, but there's also explanations for how the brain can affect some of these other symptoms. It's like how the brain has a role in, some of the classic symptoms of chronic fatigue, post-exertional malaise, muscle pain, and muscle dysfunction, even gut issues, irritable bowel, and so on. Can you talk a bit about how the brain relates to some of those symptoms, or how dysfunction in the brain plays a role in creating some of these symptoms?
Yes. I spend a lot of time researching every single symptom and how it can be related to immune and nervous system dysfunction. So the immune markers, they are simply occurring because there's overstimulation of the immune system and dysfunction of that immune system. So you'll get some markers which go up, some markers which go down, because the immune system just isn't designed to be stimulated for continually in the background. Then in terms of, let's say, muscles, muscle pain, etc., when the nervous system tightens all the muscle groups, once again, you've got buildup of lactic acid, which causes pain, which causes fatigue. And then if we're talking about the stomach and the gut, we know from studies on people with severe anxiety and depressive syndromes that actually they also have similar patterns of gut dysfunction. So people talk about leaky gut. They talk about an incorrect balance of good and bacteria in the gut, irritable bowel. That's simply because when we're in fight or flight mode or in danger mode, defense mode, the gut shuts down. It doesn't function correctly. And when the gut shuts down, you're putting food through it. It's not being digested correctly. The bacteria balance is just incorrect. The muscle groups tighten, and therefore we have diarrhea or constipation or both, oscillating between the two. So a lot of the gut issues are, once again, can be explained by an overactive sympathetic nervous system. Yeah. I mean, every symptom that I see can be explained. Pain, once again, we know in fibromyalgia, if you keep muscle groups tightened for days and days and days with no parasympathetic activity, so no healing of the muscles, then you are going to get immense amounts of pain build up. You're also going to mean that the peripheral nerves become highly sensitive. So they're sending more pain signals to the brain, and the brain magnifies those pain signals as well and sends localized inflammation back to the muscles to deal with whatever is causing the pain.
Right. I know there's quite a bit of research on central sensitization of related to fibromyalgia and muscle pain.
Absolutely. So the two systems are working together. There's central sensitization, which is causing peripheral pain, but also the central nerve, the immune system is causing local inflammation, which is contributing even further to that pain. So you can see the vicious cycle that goes on in fibromyalgia very easily. And post-exertional malaise, people who go to the gym, they'll know that straight after you go to the gym, you don't feel the pain straight away, but you tend to feel it 24 to 48 hours later. And what's happening there is, in my view, when we've stretched our muscles, when we've used our muscles, the body goes into parasympathetic mode to repair the delicate muscle fibers, and also expand them if we've used a particular muscle. Now, in the case of ME/CFS and fibro and these conditions, there's not much parasympathetic activity. So 24 to 48 hours later, instead of that nice feeling of a slight ache, but it's being healed and repaired, instead you get a huge amount of pain, a huge amount of fatigue, because that repair, heal, and digest system has not kicked in 24 to 48 hours later, which normally happens when you are exercising.
Yeah, and I think the classic symptom, kind of to go on a very basic level, the classic symptom that we're really talking about here is fatigue. Fatigue itself is a symptom. And one of the things you said in the conversation the other day was that if we didn't, fatigue is a protective symptom. It in a way, it protects us from ourselves. And you talked about the type A personalities and why fatigue is so protective. I would love if you could just kind of repeat a little bit for everyone listening on why that is, why fatigue is protective for some of these people.
Yes. So imagine you get flu, and imagine you had the flu virus, but you felt no fatigue, no exhaustion. You would probably continue on your day as normal, and you'd actually be putting your whole life at threat, at risk. So our immune systems have evolved over millennia to force us to be tired, exhausted, headachy, lie in bed and do nothing, so that we are not using up that precious energy doing other activities, but is channeled to healing. Yeah, that's where the word patient comes from. So the word patient comes from being patient, resting. Most conditions actually go through patience, through not overexerting oneself and allowing one body to do the healing. And so in the same way, the fatigue is a protective mechanism. Now, when it comes to these conditions, that fatigue, often people don't listen to that fatigue and they overexert themselves, they push through. And I believe that's not going to help. And pacing is a very, very important part of this condition. Yeah. And we notice, so we don't say there's one particular personality type that gets these kind of conditions, right? But we do notice that there is a preponderance towards what we call not necessarily type A, but achievers, helpers, and approval seekers. So these are people where if we have one of these traits, so achiever is, my sense of self relies on achievement. Helpers put other people's needs first, so their sense of self, once again, relies on helping others and being there for others at their own expense. Approval seekers, people pleasers, they tend to be people who won't express how they feel, but instead are always worried what other people think of them and are people judging me. The whole population has those to a certain extent, but we find that people who get these conditions tend to have more of that. Mm-hmm. And the reason that's interesting is because we know that people who have these traits have a background increased level of amygdala stimulation, which is amygdala being the fight or flight response from the brain. And we also know that they have more fatigue in life in general and more exhaustion and more prone to anxiety. And often at the beginning of the condition, they don't take those signals of fatigue seriously. And they push through and they push through. Talk to most clients, they'll say, I push through at the beginning. And it could be that some of those very subtle personality traits mean that they try to push through and never relax, which then means their immune system and nervous system goes into that traumatic phase of overstimulation, which then means that the body stays in this altered state. And even once they have the condition, they often find it difficult to pace themselves. So a big learning of getting better is not only changing the first vicious cycle or the loop in the brain that I spoke about training the brain to not be so sensitive to signals in the body, but the second cycle that we're retraining is getting people to relax the nervous system at an overall level and a deep acceptance of the condition being here so that they can enable a deeper level of healing. Otherwise, how can our parasympathetic nervous system healers, if we have one of these traits where we're thinking, I'm ill and I can't achieve, I can't help others, I can't, I wonder what people are thinking of me, how are they judging me? Mm-hmm. All of this is just creating more stress and pressure.
To start us off, let's talk about your big picture paradigm of the role of the brain in energy levels. So there's lots of different mechanisms and paradigms that are out there. There's people talking about limbic system dysfunction. There's people talking about childhood trauma. There's the polyvagal theory with Stephen Porges and, sympathetic versus parasympathetic. There's people talking about, more the psychological angle of negative beliefs and thought patterns. There's glial excitotoxicities. There's toxins in the glymphatic system. There's neurotransmitters. There's all these different layers of mechanisms and things that we could talk about as far as the role of the brain in how it impacts energy levels and mood, which kind of overlap. But what's your big picture kind of paradigm of the role in the brain, the role of the brain in relationship to energy levels?
So all the things you talk about, like dysautonomia, neuroinflammation, and synaptic activity and neurodegeneration, they're all part of it. But fundamentally, as a clinician, one of the things that I think most people see is that a patient comes in and one of their chief complaints is their fatigue. And one of the quickest things to do as a clinician is to go, is this brain-based fatigue or is this metabolic fatigue? And there's a difference between the two. Brain-based fatigue is a type of fatigue that shows up when a person uses their brain. So when someone says, hey, when I drive, I just need to take a nap. When I start reading, I can't go past I can't get through a chapter. That's brain-based fatigue. And that's different than metabolic fatigue. Metabolic fatigue, they just are tired for no reason throughout the day. And some people have both. But I think there's a lot of people that really have brain fatigue and they get treated for like adrenal dysfunctions and all these metabolic things. And really, ultimately, what they really need to do is get their brain healthier. And that's one of the key immediate things I would like to, kind of when you look at the big picture, first of all, what are you dealing with? And brain fatigue is a red flag of something going wrong with how the brain's metabolism is working. And then all the things you brought up then have to be dissected out to see what's the cause of it.
Mm-hmm. Got it. Is there any overlap between these two things? Like, for example, there are certain people out there who are in the chronic fatigue syndrome niche, and they've promoted a theory of, that the brain is very central to chronic fatigue syndrome, and it's specifically stress and trauma that kind of rewires the brain, the limbic system, especially in a way that promotes, very physical fatigue. I guess you might call it metabolic fatigue, in addition to, maybe brain-related symptoms. What do you see as the overlap there?
Well, there's definitely a vicious cycle back and forth between the two. For sure, metabolic fatigue is going to cause brain fatigue. The key thing about the brain is that the brain is one of the tissues in the body that's called post-mitotic tissue. It doesn't go through cell division any further. So once you're born, the amount of neurons you have in your brain, that's it. Now, those neurons can either connect with each other and develop plasticity, but the total quantity of neurons you get is what you're born with. And that's different than other tissues in the body. So like your liver's always regenerating, your gut regenerating, your kidneys regenerating, all your organs are constantly regenerating, but your brain, the amount of neurons you have are what you have. And when you have like a chronic inflammatory metabolic disease, like inflammatory bowel syndrome or something, there's going to be a toll it takes on the brain, because systemic inflammation is going to cause brain inflammation and promote neurodegenerative mechanisms. And then what people sometimes forget is the reason they're not feeling better or recovering out of their chronic fatigue is because the brain's in trouble. And now when the brain's in trouble, depending on the region of the brain, if the frontal motor areas are a problem, then using your arms and exercising is going to be fatiguing for you. If your autonomic centers, the basic ganglia that control your limbic system, are a problem, then you have dysautonomia and abnormal heart rates, and anything that raises your blood pressure is going to cause you to be fatigued. It all depends if your occipital lobe is involved, watching TV with quick flashes of screens. So one of the things, once we see someone that does have brain-related fatigue, there's a couple questions you ask. What areas of the brain are involved? And then what are the mechanisms causing it? So you could have someone that fatigues when it's really bright and they don't have their sunglasses and the brain is cooked. That's a different area of the brain than someone who fatigues when they read versus someone who fatigues if they're in a windy road. The one's a vestibular system, one's an occipital lobe, one's involved with autonomic centers for people with constriction dilation. So literally you can listen to a patient, listen to their symptoms and get fine-tuned. And usually patients say, oh, it's so weird, but when I do this, this is really what I notice the symptom. But that's specific to regions of the brain.
Mm-hmm.
So
interesting. So how separate are these different manifestations as far as the causes? And for context, like we could look at, obesity, diabetes, insulin resistance, high blood pressure, dysregulated blood lipids, metabolic syndrome. All of these things are largely different manifestations of a lot of the same root causes at the nutrition and lifestyle level. How much of that same type of thing is going on with these different regions of brain dysfunction that you're describing? Is it the same set of root causes, or is it totally different root causes depending on how it manifests?
Right. That's a good question. So the first thing is all the things you mentioned, all those metabolic conditions, all those inflammatory conditions, all promote neurodegeneration, well established in clinical research. So the question is then, why do certain areas show up and other areas show up? So that goes back to some fundamental concepts of actually, your personal neurodevelopment. So each of us have different regions of the brain which have greater connectivity, greater plasticity than other areas, right? So for example, let's say you were a kid and you grew up and you try to play sports and you were bad at it and you were uncoordinated, but you were just developing, you were a kid, but people started making fun of you and then you never played sports and you always avoided sports forever. Then your vestibular motor system is not going to develop. So you have maybe a less efficient system. So maybe then you excelled at math. Or it could be the opposite. Maybe you were terrible at math, so you avoided all math and didn't focus on sports your whole life growing up. So during that neurodevelopment state, you have different areas of your brain that have greater plasticity than others. Now, when you have that as a baseline, everyone has different degrees of greater function and greater connectivity in certain regions based on how they exercise or use their brains. Now, when you overlap an inflammatory metabolic condition on top of that, let's say like diabetes, well, the areas you're going to have neurodegeneration, neuroinflammation throughout the brain. But the areas that show up first are the areas that have less plasticity. So if you were the person who didn't have a very developed motor, coordinated muscular system because you never played sports, well, you might end up with your neurodegeneration first showing up with vertigo and dizziness and instability. For someone else, maybe it's the other one who didn't do math. They're going to start up and not remember phone numbers and remember lists. And so everyone's brain is different. Everyone's brain has different levels of connectivity or plasticity in certain areas. And then when you put a metabolic condition on top of it, the clinical presentations always show up in the first with the least amount of connectivity. So that's why it's different from one person to the next.
Very, very interesting. So as far as how nutrition and lifestyle plays into this,
what do you see? Are there sort of well-defined, more typical root causes at the nutrition and lifestyle level of these conditions? Or to what degree do you see nutrition and lifestyle as factoring into these brain-related symptoms that you're describing?
Well, they're critical. So I think one of the key things is to, first of all, as a person suffering from a condition, chronic condition or fatigue issue, or a clinician trying to figure out patients, to realize what role the brain plays, and then like what are the mechanisms. Well, obviously inflammation is a key mechanism, but inflammation in the brain is totally different than the rest of the body. So in the brain, we have primarily neuroglial cells, microglial cells, and they don't have an off switch. Okay, so in our systemic immune system, we have suppressor cells that can shut down the immune system. We don't have T suppressor cells in our brain. We don't have T regulatory cells in the brain, and we have these neuroglial cells in the brain. And then the other key feature of these neuroglial cells, the immune cells of the brain, is that they can get into a physiological state called neuroglial priming, where they don't shut off. As a matter of fact, things like traumatic brain injury that severely impact an area of the brain turns on these glial cells, and then they stay on, and they have a heightened state of an inflammatory reaction, and they're triggered by inflammation throughout the body. So you could have also someone who has like head injury, and then their neuroglial cells are already primed, head injury from 10 years ago in a car accident, and now they're starting to get early diabetes, and now they're really getting severe degeneration and symptoms there. So inflammation is a role with just a general concept of how diet, lifestyle impacts brain function. But in addition to plasticity in different regions, we all have different areas of primed glial cells, maybe from past injuries, maybe from past assaults to the brain, maybe someone's hypoxic had CO2 poisoning, who knows? And then when you add all those up, yes, the underlying cause of all these things is inflammation, but everyone has a different level of glial priming and a different degree of plasticity. So the expressions of it is all different. Mm-hmm. But underlying it, you have to treat the inflammation. Mm-hmm. The interesting thing is that when people have primed glial cells, there's only certain things that can make a difference for that from a nutritional perspective. For example, you have to take flavonoids that can actually cross the blood-brain barrier. So if you don't take it, some people, for example, have a really nice response to curcumin or resveratrol, but not respond to acai extract or pomegranate extract because, let's say, resveratrol can cross the blood-brain barrier. So some of the reasons why people go, oh, my depression or my energy change could be because of the ability of that natural nutraceutical to cross the blood-brain barrier and then actually turn on the glial cells. Mm-hmm. So that's where it gets really exciting when you think about inflammation, that the immune system in the brain is different than the rest of the body. And then in order to even get those cells from a nutraceutical point of view, there's only so many things that can cross the blood-brain barrier.